Good morning, everyone. I'm Dr. Hong Yang from the first affiliated hospital of Guangxi Medical University. And this morning, I would like to talk to you about the CUS in diagnosis of thyroid nodules. In this presentation, I will begin with the introduction into the prevalence of thyroid nodules, and then I will discuss diagnostic indicators of CUS. And after that, I would like to share several clinical cases. And finally, I will wrap it up with brief conclusion. According to the statistic report, thyroid nodule is the second highest incidence rate of thyroid disorder in China, close to 14%. This map shows global incidence rate of thyroid cancer in 2018. And from this picture, we can tell China has a pretty high incidence rate of thyroid cancer based on the recorded data. As we all know, ultrasound is the first step for the diagnosis of thyroid nodules. So today, I would like to introduce two most common used ultrasound techniques for diagnosis of thyroid nodules, which includes conventional ultrasound and contrast-enhanced ultrasound. Looking at the conventional ultrasound, there are many guidelines for diagnosis of thyroid nodules. A reporting and data system, TIRAS, was usually used to evaluate the malignant risk of a thyroid nodule, which is based on the characteristics of conventional ultrasound, such as ACR TIRAS, which from USA is the most common recognized guidelines for thyroid nodules diagnosis. But even the highest malignant suspicious nodule is ranking from 20% to 100%. So diagnosis will more rely on FNA. However, as we all know, FNA is not so prevalent in the hospital in China. So in 2020, there is a new TIRAS in China, which has more precise risk stratification in each ranking. With microbubbles and harmonic techniques, CUS overcome the limitation of conventional ultrasound and show microcirculation of tissues and tumors, which can help for more accurately and non-invasive diagnosis of thyroid nodules. Okay, let's look now at diagnostic indicators of CUS. From the literature report, poor sensitivity and specificity of CUS for diagnosis of thyroid nodules were 0.85 and 0.82 respectively. And for PPV and MPV were 0.83 and 0.85 respectively. As we know, CUS indicators for diagnosis include relative arrival time, enhancement intensity, enhancement pattern, and washout time. We can see in the table from 2010 to 2017, various indicators contribute to diagnosis for malignant thyroid nodules. Among them, heterogeneous enhancement, hypoenhancement, and peripheral irregular enhancement appear more frequently in the literatures for diagnosis. We retrospectively analyzed 816 thyroid nodules in 759 patients based on the pathology, and CUS indicators for malignant lesions include heterogeneous enhancement, hypoenhancement, centripetal, late arrive in or no re-enhancement, and CUS indicators for benign lesions include homogeneous enhancement, hyper or iso enhancement, non-centripetal, early, concurrent, or rapid and ring enhancement. There is significant difference between benign and malignant thyroid nodules with the indicators of enhancement intensity, enhancement pattern, and ring enhancement, just as the table shows. This table is show sensitivity, specificity, PVT, NPV, and accuracy of indicators, hypo, heterogeneous enhancement, and no or incomplete ring enhancement for the diagnosis of malignant lesions. As we can see, hypo enhancement has the highest accuracy at about 82%. Both heterogeneous and no or incomplete ring enhancement show lower accuracy than hyper enhancement. We also analyze conventional ultrasound combined with CUS for diagnosis of thyroid nodules. The sensitivity, specificity, and accuracy of conventional ultrasound combined with CUS for diagnosis were 0.91, 0.83, and 0.87 respectively. Let's take a look at the key characteristics of malignant thyroid nodules. The left video shows hyperenhancement and right video shows heterogeneous enhancement. These are the key characteristics of benign thyroid nodules. Hyperenhancement is shown in the left video and ring enhancement in the right video. Okay, having looked at the indicators of CUS for diagnosis, now I would like to share some relevant cases of benign and malignant thyroid nodules. The first case is a 47 years old female. Conventional ultrasound shows a nodule in the right lobe of thyroid with ACR thyroid category 3. And CUS images, the nodule shows characteristics of benign nodule, iso enhancement, and complete ring enhancement. After resection treatment, pathological results show it was the nodular goiter. The second case is a 26 years old female. A thyroid nodule was found in a physical examination and laboratory examination results were negative. Conventional ultrasound showed there is a nodule with ACR thyroid category 5, and in CUS imaging, the nodule shows characteristics of a malignant nodule, hypoenhancement, and heterogeneous enhancement. After a resection treatment, pathological results show it was a papillary thyroid carcinoma. The third case is a 38 years old female. A nodule was found in right lobe of thyroid 2 years before, and laboratory examination results show an increase in antibodies associated with thyroid. Conventional ultrasound show the nodule was ACR thyroid category 5. On CUS imaging, the nodule show characteristics of benign nodule, hyperenhancement, and complete ring enhancement. After resectional treatment, pathological results show it was Hashimoto's thyroiditis with adenomatous nodules. Case number 4. It's a 55 male. Thyroid nodule was found in a physical examination 4 years ago. Laboratory examination results were negative. Conventional ultrasound show an ACR thyroid category 4 lesion in thyroid. NCUS imaging. The lesion show characteristics of malignant thyroid nodule, hypoenhancement and heterogeneous enhancement. After resectional therapy, pathological results show it was a medullary thyroid carcinoma. Then the last case is a 48 years old female. She felt pain in anterior area of the neck for 7 days. Laboratory examination results show negative. Conventional ultrasound shows several nodules in right lobe of thyroid with ACR thyroid category 5 and NCUS imaging. The nodules show hyperenhancement and heterogeneous enhancement, which are characteristics of a malignant thyroid nodule. After resection treatment, pathological proof they were subacute granulomatous thyroiditis. So it's an exception to the ordinary rule. To sum up from the evidence discussed, we can conclude that malignant and benign thyroid nodules show different characteristics in CUS imaging. Combined, conventional ultrasound and CUS can improve differential diagnosis efficacy of thyroid nodules. Thank you, everyone.